Hello, and thanks for joining us for today's webinar on the role of fathers in children's health. I'm Dave Chancellor, and I'll be your host. This webinar is co-sponsored by the Institute for Research on Poverty and the Wisconsin Child Abuse and Neglect Prevention Board. The Institute for Research on Poverty, or IRP, is based at the University of Wisconsin-Madison and is the sole National Poverty Research Center funded by ASPE at the Federal Department of Health and Human Services. The Prevention Board is a state agency that advances statewide policy, public awareness, and evidence-informed programming to strengthen families and reduce the likelihood of child abuse and neglect, and it seeks to address those goals through the mobilization of research and best practices. Our presenters today are Tova Walsh, Daryl Davidson, and Craig Garfield. Tova Walsh is an assistant professor in the School of Social Work here at the University of Wisconsin-Madison and a research affiliate of IRP. Daryl Davidson is the director of the Milwaukee Fatherhood Initiative, and that's a recent promotion, so congratulations to him on that. Craig Garfield is professor of pediatrics at the Northwestern University Feinberg School of Medicine, and he's attending physician at Lurie Children's Hospital of Chicago, where he directs the Family and Child Health Innovations Program. So we'll have an opportunity to hear a little bit more about our presenters in just a moment here. But Tova, Daryl, and Craig, thanks so much for being with us today.
Thank you. It's great to be here.
Thank you, David.
Thanks. Go ahead. Sorry. I also want to acknowledge the Office of the Assistant Secretary for Planning and Evaluation at the Department of Health and Human Services for their support of this webinar series. That said, any views expressed in today's webinar don't necessarily reflect any positions of ASPE, the Institute for Research on Poverty, or the Wisconsin Child Abuse and Neglect Prevention Board. So as we get started, quick outline of our webinar today. We've got an hour, and the presentation will take about 45 minutes. And we'll save the time after that, 15 minutes or so, for your questions. Many of you submitted questions during registration, and some of those we'll be able to get to during the presentation, and some we'll get to during Q&A. But you should also feel free to type questions that you have into the Q&A box at the bottom of your screen throughout the webinar today. So with all that, Tova, Daryl, and Craig, thank you again for being here. And if I may, can I invite the three of you to tell us a little bit more about your background and your perspectives in coming at this topic? And Tova, I believe you'll be leading us off.
Yeah, thank you so much, Dave. So I'm Tova Walsh. I'm an assistant professor here at UW-Madison School of Social Work, as Dave said. And my research here focuses on understanding and improving health and well-being in families that face multiple stressors, with a particular emphasis on the period surrounding the birth of a baby, so pregnancy and early parenthood. My research centers on better understanding the parenting support needs of underserved groups, including expectant and new fathers, and developing and testing parenting interventions to meet their needs. So I'm really quite excited about the topic that we're going to be discussing today, and thrilled that I get to do this with Craig and Daryl today. And I'm going to pass it over to you, Daryl, to introduce yourself next.
Thank you, Tova. So I'm Daryl Davidson. I'm with the City of Milwaukee, and I am the director of the Milwaukee Fatherhood Initiative, which is a strategy that was presented by our mayor in order to execute what we call a spoke and hub approach. So we are the organization that connects men to resources, connects organizations to the men. We are prioritizing making dads better fathers, making sure that children are connected to their fathers and are enhanced in their growth and health and development. And we also have a real sense of what's going on as far as how things are changing in families, so that fathers are becoming much more involved than they may have been perceived traditionally as being caregivers. And so we have resources for those things, and we are very thoughtful in approaching fathers to let them know that it's not just about the finances, it's not just about what might be a traditional image of a father, but it's also concentrating on the child growing up. And so that's a day-to-day activity that they would be very much a part of and influential in.
Thanks so much, Daryl. So Craig, I'm going to pass it along to you to introduce yourself.
Great. Hi. Good afternoon, everyone. My name is Craig Garfield, and I'm a professor of pediatrics at Northwestern and an attending pediatric hospitalist at Lurie Children's Hospital in Chicago. And really, I came to this area a while ago when I finished my residency in pediatrics in Boston, and then spent a year at home as a stay-at-home dad with my then 18-month-old son, and realized, even as a pediatrician, how little I knew about being a parent and how little credit we actually gave to most fathers in the pediatric world, and that I really felt like it was a missed opportunity. And so started looking into this area and actually ended up co-authoring the American Academy of Pediatrics clinical reports on fathers in pediatrics, where we really tried to highlight the literature and some of the advances that have been made in understanding the role of fathers play in the health of the child, and have started to look at the bidirectional way in which fathers influence child health, but also children influence fathers' health. And most of our research has been focusing on supporting parents in general, but focusing particularly in the role of fathers. That's led to a new initiative at Lurie Children's Hospital called FCHIP, which stands for the Family and Child Health Innovations Program, where we really are trying to solidly plant child health within the context of the family, that we really understand that children thrive when parents thrive, and that we can take this holistic approach to the family and all the different types of families we see across the country now, whether that's a grandparent family, same-sex families, trans families, heterosexual families, all the different variety that we have, and really try to focus on what brings us together during that time. I've yet to meet a family that doesn't want the best for their child from the time of birth all the way forward. And so it's really trying to kind of focus on that as a way to move us all forward for the betterment of the child. So that's my background.
Thank you. So I'm going to just walk us through an outline of where we're going with this presentation. And so we're going to start by talking about fathers' influence on the health and development of their children. We're then going to talk about the effects of fathers' own physical and mental health on child and family well-being. We'll talk about the role of fathers in children's health care and strategies for health care and child and family service providers to more effectively engage fathers. And just as a little bit of a preview of where we're going to be thinking in particular about opportunities to engage expectant and new fathers to set up strong trajectories of involvement. We're also going to think about strategies for promoting fathers' own physical and mental health and opportunities that present themselves as men become fathers, and talk about supporting fathers to model positive health behaviors for their children. So that's a little bit of where we're headed, and then, as Dave said, we're setting aside time at the end for questions and discussion, and we're really looking forward to engaging with all of you. So just as kind of context or laying the groundwork for the conversation that we're about to have, we wanted to start by acknowledging that the definition of fathers is complex, and things like biological fathers, stepfathers, father figures may come into the definition of a father. And for our purposes, we are referring to any man who plays a fathering role in the life of a child. And we're recognizing that fathers make a really important contribution whether or not they live with their children, whether or not they are currently in a relationship with the child's mother, that there are opportunities for fathers to be really significant and play a critical role in supporting their child's healthy development in a whole variety of family constellations. So we want to hold in mind diverse family compositions, and we also want to acknowledge that in discussing fathers, it's not our intention to diminish the role of mothers or others who play critical roles in the lives of children, but to recognize that for many children, a father is a really critical figure, and that early relationship with a father is so important. And so we're going to be focusing on fathers today in the spirit of inclusion and not exclusion, and want to hold in mind that notions of the role of a father are diverse and influenced by cultural and demographic factors. And so there's complexity here, and we'll get into that as we keep going forward. So we're going to start now with talking about fathers' influence on the health and development of their children. And Craig is going to start us off by talking about how that influence and how father's role begins even before a child is conceived. So I will turn it over to you here, Craig.
Thanks, Tova. So there's a very key concept of preconception health that is making its way through on the maternal health side of things. And I think there are great opportunities in this area to learn from the focus that maternal health is receiving and has received, to think about that in terms of father's health. So this is a graphic that may be a little bit hard to see in this presentation, but you can check it out on the slides, where we kind of proposed what preconception health might include for the father and what issues you might consider addressing from the prenatal into the perinatal and into the postnatal period. And we actually developed this image because for many men, they are out in the community doing whatever it is that they're doing. And it's only through this narrow kind of bottlenecked area that we actually start to see them frequently in the healthcare system. So we know that men are among the least likely to have a primary care pediatrician or have a primary care physician, and to actually have been accessing in the last year have seen a doctor. Well, that means that the one place that they seem to pop up more regularly is around the time of the birth of the baby, when they actually do show up in the healthcare system, albeit that that's often as a chaperone with their partner, or even with their new baby. But the things that are important to consider in the prenatal period are talking about the father's physical health, talking about their mental health, because both of these things predict their eventual health and well-being, and understanding and helping the father to understand his influence on the mother and on the fetus, whether that's in reducing stress and providing support for the mom, or providing other sort of benefits to the mom during the pregnancy period. And this is not even getting into some of the new and exciting research that looks at the quality of the sperm and what that effect has on the fetus as well. When you move into the perinatal period, then where there are increased pediatric and obstetric chaperoning visits, it's really having an opportunity to talk with the father about that transition to fatherhood, what that's going to mean for him, how he can be supportive in the key things like breastfeeding and dynamics between the couple, and to anticipate those changes, as well as making sure that he's getting those key immunizations that he's going to need, like flu vaccine or pertussis, that's going to protect himself as well as the family. And then in the postnatal environment is thinking about what has happened with the roles and responsibilities of the dad, how to balance work and family, as we don't have effective family leave policies right now. And then again, screening again for the physical and mental health issues. So all of that really is part of the framework that the CDC now considers as preconception health, and things that men can do for their own health as well as the women and children in their lives. During pregnancy, partner support has really been associated with positive maternal and child outcomes. Father involvement prenatally increases the likelihood of mothers receiving first trimester prenatal care. And women who have supportive partners have fewer health problems in pregnancy, as well as the quality of that partner relationship predicts how both the mother and the father will nurture and respond to the needs of their child. So it really does all start at the very beginning, and a lot of our work has been focusing on that key time period in order to help the family grow and to be the best supportive family they can for that child. So one of the things that we've been doing for a while is conducting expectant fathers classes, and this is an article that was in the New York Times a couple years ago that featured our class, where we really get dads in a room, and for many of them it's the first time that they're in a room with other expectant fathers, and we talk about what to expect when you're waiting to have that baby and how difficult it might be. And while there are classes that are offered for couples, it's rare that a dad will stand up in a family full of pregnant women and talk about how difficult this phase of his life is for him, given that it's actually his partner and the other women in the room that are actually going through these major changes. So we see this as a great opportunity. It's where 20 men are sitting and really getting down to what's really going on in their life and opening up to this group of people in this class. And it's been really quite eye-opening, and I think one of the dad's favorite moments of their prenatal time. We've then converted that now to focusing with and talking with dads in neonatal intensive care unit at Prentice Women's Hospital, where I do a lot of my clinical care. Because these dads were not expecting at all oftentimes to be in the NICU, and this is a completely different world. They were already worried and scared about, a 8 or 9 pound full-term baby, and now they've got a 1 or 2 pound premature baby, and they are just really trying to figure out what they're supposed to do when they're not able to do their normal parenting role, which they already were not so confident about. So we now have a session that we're doing with dads in the neonatal intensive care unit in the NICU, to help support them understand what they're doing, not only for themselves, but for their partners, how to support their partner, as well as for the baby and how to be involved with the baby. So I want to invite Daryl to also chime in here and talk about some of the work that he's doing with Starting Early as well.
Yes, Craig. So what we have in Milwaukee, we will have parenting classes and prenatal classes at the hospitals and some of our organizations. We have our fathers in sessions where we specifically address some of the things on what they should expect, as well as talk about screening schedules. We also have discussions around the importance of having a pediatrician and knowing that pediatrician and understanding what that particular physician's role is in a child's life. But more than anything else, we do prefer to have conversations around the fathers engaging with the mother of the child before the child is born and discuss, these are the types of things that I'm familiar with, this is what I know, this is what I don't know, having the conversation around where they can receive some support. We have our DAD project, which is located in the City of Milwaukee Health Department, which is the Direct Assistance for Dads Home Visiting project. Is a very unique program where it's a thoughtful, concerning home visitor, a social worker will come to the home, will explain what the emotional significance is of the father's bonding with the children, and talk about those things that fathers don't generally think about. For example, if the father hasn't grown up around a father, they talk about what the roles and the expectations are traditionally with the father, and if they have grown up with a father who may not have been very clear in how they express their relationship, they let them know that it's whatever the relationship is to you. If you say that this is something that is very important, as it should be, well then we want to make sure that those things are maintained. So the fathers are giving information, the fathers are given opportunities to attend classes, and also we have practice activities so that they know in the future there will be screening for the child as well as screening for themselves with stress, and they will have an opportunity to learn about supporting breastfeeding and other things that meet the routine demands of the baby. And more important than anything else, we do stress communication and making sure that they are involved and consistent. So for us, it's been a pleasure dealing with this, and we have a variety of stories from the dads who are letting us know that they believe that what we're doing is worthwhile.
Thanks, Craig and Daryl. So we'll come back to talking in particular about the special kind of significance and opportunity during expectant and early fatherhood, but want to also highlight the influence of fathers across childhood and adolescence and even into adulthood and beyond. So across a child's growing up, fathers influence child health and development in a number of ways. So through their parenting behavior, the ways in which they engage in caregiving and play, that matters for child health and well-being. Through their participation in decision-making and ensuring that children are cared for, so decisions about child care providers, decisions about pediatricians, scheduling those appointments, fathers' role in taking responsibility for those critical tasks is also a part of influencing child health and development. And the input that fathers have through their participation and preparing meals and supporting children to develop good sleep habits, to support exercise and play, all of these kinds of things are ways that fathers are involved in child health and development. And what we see is that when fathers are involved in positive ways, when there's a supportive kind of nurturing relationship, that's associated with a whole set of developmental benefits to children across infancy and adolescence and beyond. So associated with positive social, emotional, and cognitive outcomes, things like greater school readiness, things like stronger relationships with peers. And this tracks kind of across infancy, across adolescence into adulthood, where we see that boys who were raised by caring fathers are more supportive as parents and partners in their own adult lives. So there's even kind of an intergenerational transmission of effects where the significance of a supportive father really carries across the life course. So we're going to move now into talking about the effects of a father's own mental and physical health on child and family well-being. And Craig is going to talk a bit about this. Mm-hmm.
Yeah, so maternal depression is actually something that's been researched a little bit more in the last number of years. Interestingly enough, the first time that we wrote the American Academy of Pediatrics report on fathers and pediatricians in 2004, we actually had some information in there regarding paternal depression and paternal postnatal depression. And when it came back from review, they said, there's no such thing as postnatal depression for fathers, so we need to take that out of there. And we were surprised because clinically in the office, we've seen kind of cases of this. And it wasn't until 2006 or so that some of the first literature came out describing paternal depression. And that's really been growing, and so much so that in this last version in 2016 of the Committee on Psychosocial Aspects of Child and Family Health report that we put together, we actually have about a page and a half in that report that talks about all the research that's come along. And I would just kind of point you all to that if that's of interest to you. We know that there's a heightening of paternal depression around the period of the birth of the child, and it ranges anywhere from 2 to 25% in terms of a prevalence rate, and that it is correlated with mothers who are experiencing paternal postnatal depression. And this depression can negatively impact the co-parenting relationship as well as the interactions and the interaction with the child. One of the key tasks of early childhood is bonding with the infant. And from that, then attachment theory teaches us that the child then learns to safely explore their environment. And if the father is experiencing mental health problems or the mother, that can adversely affect that child's ultimate development. So this is something that we really need to be aware of and need to be addressing and thinking about anytime that we're engaging with dads and anytime that we're kind of engaging with new families. The fathers with depression may also present differently than mothers. For some fathers, it may be that they actually are increasing their use of substances. They may go and try and get more involved at work as a way of withdrawing from the family. And some of the kind of basic ideas of of screening really ask, in the past 2 weeks, has dad not felt any joy or an ability to have fun in things that he used to do, or any pleasure, and has he felt down or depressed? And those are just some very easy screening approaches to take, because there really is this limited awareness of paternal postpartum depression. On the maternal side, there's much more awareness of it, and the fathers, we just still need to kind of improve our education and understanding of it. We know that fathers also do play a key role in kind of modeling behaviors for their children, and our work has really pointed to the time of becoming a father as a time where many men are trying to figure out what their roles and responsibilities are, and that can be a lever for change and improvement in father's health. So knowing that dads have gotten their pertussis vaccine and gotten their flu vaccines, and if we come up with a coronavirus vaccine, then make sure they have that as well. But the unhealthy habits that dads do may be watched by children. And then the flip side of that is that fathers often will try and clean up their act once they become a dad, that they see that really as I said, a lever for change, but also an opportunity for them to start thinking about how am I going to be around in the future to be there for my child. Many of the dads that we've interviewed have said, I used to hang out in risky situations, but now that I have a child, I want to change that. And that there probably is a window of opportunity in there to impact the dad's behaviors before bills start coming and other responsibilities start coming, and then they may slide back into their old ways. And dads also play a key role in the financial situation, even though that's a more old school traditional way that we think about dads as kind of providers. They still do end up contributing to the financial situation of the family, and that plays an even bigger role if moms are taking leave and that leave is largely unpaid. Then dads do need to be helping to support the family from a financial point of view.
And Daryl, maybe before we go on from there, I'm wondering if you want to add anything about what you've seen in your work in terms of the influence of fathers who are struggling with depression, or opportunities for encouraging fathers in their health behaviors as modeled for their children, things that you see in your work.
Absolutely. I like the word opportunities because that's the language that we're using. We're addressing the fathers and we are speaking in positive terms. What we are emphasizing is health promotion. So often the fathers will begin a conversation, and you can tell that they're starting to become stressed around the topic of finances. A new child is coming into their life. It's completely changed the manner in which they may have either planned, or it may go outside of what they planned. And so we want to have that conversation around, this is not about being perfect. Being an excellent father never had to be connected to perfection. It's about being consistent in the verbal and the nonverbal. It's about showing up when the mom is there and says, you know, I'm at my wit's end, I'm getting frustrated. Well, it's not time to be for both people to be frustrated. And we know from our experience that many of these fathers have risen to the occasion in extremely demanding situations, because often the fathers that we're working with do not have cars, and yet they have to go to their jobs, or they must meet the needs of, let's say, the court system or other service organizations. We're asking the fathers not to beat up on themselves too much. That baby is going to come. That baby is going to be a part of their lives. They can be a role model, an example, and typically they think about things that are tangible, such as money, but we talk about this is how you can influence them later. It's school. It's how they communicate. It's you can read to them. You can have that relationship where you bond with them every day. Have some fun with them. Show that you're a responsible person. If you are prepared, you will be feeding them. You will be bathing them. You will be doing all of these things. The mom will be, you know, asleep, and the dad will be taking care of this child. You're letting them know that you are an equal caregiver, and that's the point that we consistently make with them. It's not the dad is the second parent or the dad is the substitute parent. The dad is the parent who is the other parent aside from the mom, and we want them to function together as a comfortable unit and get those goals met.
Thanks, Daryl. So we're going to move into talking now about the role of fathers, specifically in the context of children's health care.
So we know that fathers' involvement is increasing, and it's actually more than doubled since 1965. We, of course, have to admit, as Tova said at the beginning of the session, that mothers still are providing the lion's share of care. But nonetheless, there are an increasing number of dads that are showing up in typical child health care environments. So we know that there's an increase in dads coming to the prenatal visits, attending labor, even amongst typically unmarried couples. The vast majority of dads are going to be there at the birth of the child and in the delivery as well. And for those men, they actually, and women, they both are optimistic about the relationship. And if you ask those men and women at the time of birth of whether the dad is going to be there and be involved down the road, and a year later or so, if they think they'd be married in the next year, many of them at the time of birth will say, yes, that is our expectation. And then if you fast forward into the next year, you find that actually only about 10% or so actually do move forward with that. So nonetheless, I think from the healthcare perspective, it's important to open the door for fathers who want to be involved as opposed to close the door, and really help to facilitate that involvement. And that includes things like welcoming them to the well-child visit, welcoming them and asking them about how they think the child is developing, and how in our research we've found that dads have different questions than moms, and while they may not be able to make it to the appointment, they still want those questions answered. When they do show up at the appointment, it's important to acknowledge them as the parent and not just stereotypically talk about the big game that went on this weekend and then talk only to the mom about the child and the child's development, but to really include them in the visits. Because ultimately, healthcare decisions that are made for children need to be accepted by both moms and dads. If only mom is making the decision and dad doesn't agree with it, or vice versa, then when they go home, they're unlikely to follow up on that. We see that also in the area of diet and nutrition, where if mom is being counseled to cook food a certain way for the child and for the family, but she goes home and dad wasn't there and dad wasn't on board, then chances are that they're not going to be, she's not going to be able to follow those recommendations. because she's trying to, both provide food for the dad and for the mom, for the child, and in that way, you're kind of setting her up not to succeed. And then also in terms of managing chronic conditions, if this is a child who spends time at mom's house and spends time at dad's house, it's important that both parents understand what the healthcare implications are of that and how to make sure that in both home settings that they can take care of that child should they get sick, for example, with asthma, that they both have medications and they're ready to know what the response is for when that child's asthma exacerbation kicks in, what they need to do when the child is at either one of those houses.
So across a series of qualitative studies, I've had the chance to speak with a number of expectant and new parents, including dozens of fathers, about their experiences of father engagement in prenatal and pediatric care. And I wanted to highlight a couple of things that I've been hearing and that I've learned from the fathers I've had the chance to speak with. So first is that mothers and fathers both are talking about how much they want and expect fathers to be involved in prenatal and pediatric care. And, and they acknowledge, feeling a dual role. When they come to prenatal care, they're there to support their partner, but they're also there as a parent. And so they want to be responded to in that way. So, recognized for the support role that they have, but also as an active, parent to the child who needs to learn all the things that the mom needs to learn about how to care for an infant and how to prepare for parenthood. Fathers talk a lot about how meaningful it is to them to participate in prenatal and pediatric care, sometimes in the context of prenatal care talking about how moments like a prenatal ultrasound has a special significance to them, given that they're not having the bodily experience of pregnancy, that, being able to show up to those appointments, to see the baby on the screen, to hear what the clinicians have to say about how baby is developing and to keep up with that is really significant for their own, beginning to develop attachment to the baby and beginning to develop an identity as a father. Fathers also talk about at times feeling marginalized or uncertain of how to engage. So sometimes the setting is more receptive and sometimes it's less receptive to fathers. So if you're coming into a room for a prenatal care appointment and there's not an obvious place to sit or no one is greeting you, then it's really easy to feel like maybe I don't belong here. And on the other hand, when clinicians are welcoming and greet, mothers and fathers both by name, when they address themselves to both parents and invite questions from both parents, then fathers feel really included. But I've heard from fathers about really varied experiences of feeling included or excluded in the context of both prenatal and pediatric care. And then the other thing that I wanted to point out was that, fathers will identify when I'm talking with them about their experiences in prenatal and pediatric care, they'll talk about, the specific kind of knowledge or skills, things that they need to learn, that they need to get a handle on related to engaging with or caring for their children. And so when we create the space as providers for them to do that, it allows them to surface the questions that they've got. They have a pretty good sense of what they might need to know. And often those questions, when it's first-time fathers, it might center on engaging with infants or toddlers or very young children. So sometimes they kind of can have a clearer vision of with an older child ways of engaging and the kinds of things that we'll do together. And then it's harder to imagine with an infant what I'm going to be doing. In particular, fathers will talk about, well, if the mother's breastfeeding and that's, both food and comfort, like I'm not sure what I can do to engage or start building a relationship at that point. And so fathers are looking for, for ideas. In some quantitative research that we've done with colleagues, including Craig on one of these papers, I want to highlight a couple of things that we've heard from a sample of young men, so a nationally representative sample of men who are aged 18 to 35. And one of the things that we've seen is just how normative it is for fathers to be involved in both prenatal and pediatric care. So, if anyone is thinking that they're not showing up, this data is really suggesting that, in fact, it's very common, right? So 88% of fathers of young children reported that they had attended at least one prenatal ultrasound. 81% of fathers said that they attend pediatric visits sometimes, often, or always. So the vast majority of fathers, including large numbers of non-residential fathers, including large numbers of fathers who might have health challenges of their own, fathers are showing up. And so this is an opportunity to encounter fathers, to engage them, to think about what support they might need as parents or support for their own health, which is impactful, as we discussed, in the lives of their children. This is a chance to encounter and engage fathers and connect them to resources that they might need. One of the things that we're seeing in our research is that prenatal engagement is associated with participation in pediatric care. So if a father comes to prenatal visits and feels like he's really kind of excluded and not welcomed in, that's associated with a reduced likelihood of him showing up to well-child visits. So these early clinical encounters are really important for establishing relationships and kind of making clear that the father is really kind of wanted and welcomed and central to the care of his child. Another thing that we're seeing has to do with gaps in knowledge of early development. So we did a study where we asked a set of questions that are based on the Bright Futures guidelines that pediatricians use to think about the kind of information that parents of children might need at different ages and stages of development. And, in fathers and non-fathers, so among young men in this sample, fathers certainly, knew more than non-fathers, but among fathers as well as non-fathers, there were some significant gaps in knowledge suggesting how important it is for pediatricians to be providing information to all parents or home visitors or others who are working to provide child and family services around the time of the birth of the baby, that all parents really need to be getting the guidance that all caregivers need. So if we're providing education around the infant sleep or routines or safety, that this kind of information needs to be transmitted to all caregivers, where often if we're not making the effort, it might just be by default that many providers are providing that information to mothers and leaving it at that, but any effort that we can make to engage everyone who's an active caregiver and parent to the child is really significant in terms of supporting children's development. So I want to turn it over to Daryl now to tell us a little bit about what he hears from fathers about experiences in prenatal and pediatric settings.
Yes, so most of the time we have our home visiting clients here in Milwaukee. We meet with them usually twice a month, and then near the end of the month there's a group connections. It's a part of the curriculum that they have, but they are meeting with other fathers. So these could be other fathers who've been a part of the program for years, or maybe fathers who have graduated from the program and enjoy the company. But these are men who have the experience, and talk to them about the importance of listening to the mother, making sure that the men are clear that you are a leader, but leadership does not look like the same thing in every household. And leadership certainly is not, giving out orders or I'm not going to be there, you just report back to me. It's about considering what the needs are in the household and then being reliable and delivering what those needs are. So we express to them that it's important in the prenatal period, know what the baby and the mom need before you continue with getting ahead of yourself and thinking about what's going to happen after the baby is here. So what are the schedules of the visits? What types of screenings are appropriate? What is an ultrasound? Most of the questions that we're asking have to do with why are we doing this particular procedure or activity, and what's the frequency. And we want the fathers to develop a schedule so that they're the ones writing down the information. That's keeping them engaged with not only who the service providers are, but it also gives them another way of connecting with the mom before the baby gets there. The benefit of that after the baby arrives is if the father is consistently writing down information, now that becomes the father is assisting with writing down the information on when the baby is getting changed, when the baby is sleeping, when the baby is bathing or getting bathed, when the baby is receiving the breastfeeding. We want them to also keep in mind that you may not get exactly what you expect in all social service settings or pediatric settings. It is a possibility that people might ignore you or look to you as being the second parent, so you need to speak up. And the benefit of that is if you are speaking up or if you're the one asking questions, it also creates the pattern where when the child is older, they see that behavior. So now you have a son or a daughter who notices that the father is engaged, the father is concerned about their well-being. that's increasing and building up their self-esteem. If that behavior is consistent, both verbally and non-verbally, then there's a great amount of trust that comes out of it. So we're getting that information from our experienced dads, and many of our younger dads are benefiting from that information.
Great.
Again, we know that mothers are generally more involved with their child's direct care, but a father's involvement and participation in that care has been linked to higher adherence in treatment, some better psychological adjustment, and improved health status compared with families with non-participating and non-involved fathers. There is some difference in the research that shows that the measures obtained separately from mothers and fathers suggest that there is something important in looking at the multiple perspectives. And this goes both for when mothers and fathers report kind of who does what within the family, but it also goes for those situations where we're collecting information on the child, that the mom's and the dad's perspectives are a little bit different. The father participation in care is associated with higher treatment adherence and better family adjustment overall in the care of the child. And these are all kind of health-seeking behaviors that are highly correlated among family members. So in a way, it helps to think of the family as one kind of big constellation, an understanding of the context of how that family is going to function, who's responsible for doing what, and how best to help each member of the family to support the family as a whole results in better child outcomes over time.
So we're going to talk now about strategies for healthcare and child and family services providers to more effectively engage fathers. And want to start just by talking briefly about the importance of learning more about fathers' experiences, circumstances, involvement, and needs. So another way of saying this is that, a lot of the programs and services that we provide are based on kind of research and practice experience that has centered on mothers. And so some programs, like the program that Daryl mentioned, the Dad Project, starts with and centers fathers, but many programs are trying to become more inclusive of fathers in their practice. And to do that, we really need to understand more systematically about what fathers might need, as well as understand from specific individual fathers about what the role of father means to them and what kind of support they might need. And so Craig is going to talk to us a little bit about the importance of research with fathers and some research that is underway.
Yeah, so I'm excited to talk about this because I think this is an area that we don't really have any good data on. We might catch fathers in some of our national studies, or we might catch men who are fathers, and we try and then draw some conclusions from that data. But we really have no good surveillance data, public health kind of surveillance data on men during that transition to fatherhood. And we know, it's unfortunate because we know that fathers play a key role in the health development of their children, and that they influence the decisions around pregnancy, the mom's health, and the infant and child care development. We know that postnatal father involvement, as we said, is involved with better maternal health and better child outcomes. But we really don't know as much about the roles and behaviors of expectant fathers and what happens during that transition to fatherhood for men specifically. So there are challenges, of course. We know that the response rate in surveys in general is much lower for men compared to women. And that fathers may be unknown, or the contact information may be missing on the birth certificate, as most of the studies that are done looking at moms use the birth certificate data as something to, as the way to contact that participant to collect the data around the time of the birth of the baby. We also know that the non-residential fathers, the fathers who aren't living in the same home and are not married to the mother, that those communication, those addresses are not as good as information related to married fathers. So that's really the challenge in this particular area. But it's from understanding this that we can then kind of understand from a public health perspective how best to address this issue. So the CDC has been conducting the PRAMS survey of mothers, it stands for the Pregnancy Risk Assessment Monitoring System. They've been doing that for mothers for about 35 years. And just recently have been thinking about how do we include fathers in this. And we've been working with them to kind of develop the PRAMS for Dad survey system. And I'll just skip through this slide in the interest of time. But essentially what we've designed is a pilot study that we've been doing in Georgia with the PRAMS states. And PRAMS was represented in almost every state across the United States, including New York City and DC. And it represents about 85% of births. So we're trying to understand how to do that on a state level. So if there's anyone on the call who's involved with the PRAMS studies in their states, we'd love to think about how to move this to other states as well. And what we did was we first wanted to figure out which way is the best way to reach dads. And you can kind of put down your own money on which approach you think would be most useful, whether it was sending the survey to the mother and use the mother as gatekeeper, where we just include the survey in mom's packet, or if we actually went and mailed the survey separately in a mailing to dads. And these surveys had questions around really important topics like dad's own health care access, dad's substance use, dad's physical health, mental health, dad's use of leave, dad's feelings around breastfeeding, use of contraception, dad's weight changes during pregnancy. So all sorts of really important key topics, e-cigarette smoking, all these things that are really important to know, and no, we don't have any data on that around the time of the birth of the child. We then designed two separate studies here, or two separate surveys. You can tell the one in yellow is the one that was going to moms, and the one in blue is the one that was going to dads. And then we actually had to kind of change the design a little bit to include the PRAMS for Dads survey. And then we ended up doing a randomized sample of taking the moms. We had over 1,000 of them. Some of those moms had no contact at all and no information about dads. So we ended up with a final sample of about 857 dads. And then if you put your bets down, now you can hear what the final result was. When we actually sent out the survey, it was exactly even. Direct to dads and mom as gatekeeper both had the same response rates. And so our next step in analyzing this data, we just finished this at the end of last year, is to figure out which of these groups actually provided us with data from the most hard to reach group of fathers. And that's going to be the work that we're moving forward with, as well as trying to expand this into other states so that we get a sense of more of how dads are transitioning to fatherhood in each state.
Great. So we're going to go relatively quickly through some strategies now for engaging fathers, and then move into discussion and Q&A. And so as we think about strategies, one thing that kind of guides us is thinking about, first, about the barriers that need to be removed. And so one is beliefs that act as barriers, whether it's fathers' own beliefs or the beliefs of those around them, including providers, that father participation is either not important or extra or optional, as Daryl was saying before, treated as a second parent. Sometimes a bias among providers even that fathers represent, risk to their families, or providers might have discomfort or uncertainty engaging fathers. And my colleague Alvin Thomas here at Wisconsin is doing some work on that, showing that in the context of family therapy and psychological services, that providers can really present significant barriers if they are uncomfortable or unprepared, untrained to engage fathers, and to engage in particular when there are complicated dynamics between mothers and fathers. Some additional barriers for dads include competing responsibilities that might interfere with participating in services, like programming that's only offered during their work hours, or tension with the child's mother can be a barrier. And so some of the strategies that we're going to talk about are meant to overcome some of these barriers or address them. And so one that we have named as we've been talking is extending a personal invitation to fathers and encouraging their participation in prenatal visits, delivery, postpartum, and continued child health visits, really making sure that fathers know that they are very welcome, and this is very much a place where they belong. Communicating with fathers, including non-resident fathers, and a piece of that, the anticipatory guidance that pediatricians provide, making sure that that's getting out to all parents, making sure that in the context of other child and family services like home visiting, that fathers are being reached. Presuming high interest, so not condescending to fathers or assuming that they don't want to be there, but assuming the opposite, that fathers want what's best for their kids and want to be involved, encouraging their participation, addressing practical barriers like adjusting hours to the extent that that's possible, creating a family-friendly environment and a father-friendly environment, so ensuring that images of diverse families, of families that include fathers, are represented in your waiting room and your program materials. that everyone is welcomed and greeted by name, and reinforcing fathers' contributions and their roles as model of health behavior. And so I breezed through that pretty quickly, but I'll pause here to see if Craig or Daryl would like to chime in on any of those strategies that you might have used or that you've seen to be effective in your clinical practice or home visiting practice.
Well, I certainly will agree with presume high interest. Even when the fathers are reticent, they may seem nervous. Once we begin discussing the importance of their role, talking about how the baby is a great influence in bringing out the best in them, they become enthusiastic because they're shaping someone's life. And we encourage a change in language also. We're asking the fathers to start using we and us, not just talking about he and the mom, but also about he and the child or children. We make a big point about emphasizing that informed people are powerful people, and within the context of where the DAD Project is located in the city of Milwaukee, it's located under the umbrella of Empowering Families of Milwaukee. So that's the program, that's the name, because that's what's happening with our home visiting clients. We want to make sure that they receive the tools so that they'll be able to leave us and enlighten their children with whatever skills or whatever activities that they have learned from us or are learning from their peers in our group connections. And something else I want to add before I turn it over to Craig, we want to emphasize that the men are learning differently than the women in our session. So we want it to be extremely focused toward their learning styles. If it needs to be more action-oriented, that's the way we're going to make it, so we have more activities. We keep the themes limited to a specific topic, so we make sure that they're focused. We don't try to give a barrage of information so that it's overwhelming them. And we also want to make sure that we emphasize it's okay. You don't have to be perfect. And if you believe that you're perfect, what you're probably going to do is send that message about perfection to our baby and to that young child, and then that is very likely to distance the child away from you. That's not what brings the child towards you. If you make mistakes that are just, that's what happens, well, then you can laugh about it. It's okay. You could even talk about what your limitations are. It's a great opportunity to get the child to see that maybe you do need to call the plumber. You do need to call the electrician. Somebody else needs to fix your car, and that's the other reason why you need to go to a pediatrician, because you don't know everything, and it's perfectly fine. And that's what leadership is all about, too. Craig, did you have anything?
Yeah, I would just add, when you walk into the room and you make eye contact with that dad and you say, hey, good morning, it's nice to see you. Something simple as that I think just acknowledgement of them lets them know I value you being here, and I'm going to talk to you also, and position yourself in a way to actually be able to do that.
Mm-hmm. And it's such an important point, I think, that the interventions can be pretty basic, right? Like the greeting and making sure that you're making contact right away in that way is a pretty simple intervention to really increase fathers' feelings of welcome.
Or even, Tova, if in our case, the home visitor goes in, ignores the father, make sure to acknowledge that that's not the right thing to do. Apologize. So let them know they are a part of this process from the beginning.
Mm-hmm. Yeah. Great point, Daryl. So some other strategies that we want to name. One is programming where fathers aren't outnumbered, and Craig spoke to that with his example of the expectant parent classes that are specifically for dads, so dads can feel comfortable raising concerns they're having, as opposed to in a context where they might be one of very few men in the room and might feel less able to speak up about what their experience is. Allowing families to define the father role and recognizing that varies. Learning about and responding to fathers' individual circumstances, normalizing screening and discussing father-centered health concerns. So we talked about depression as one example in this webinar, being sure that we're attending to depression on the part of any and all caregivers. Offering resources and collaborating with other providers to help fathers achieve parenting and related goals. So it's not that everything needs to be taken up by the pediatrician or the home visitor, but knowing who the other resources are in town that you can make referrals to when fathers need additional services. Advocating for family-friendly policies like paternal leave, as well as maternal leave, parental leave, and taking advantage of moments of opportunity And one that we talked about throughout the webinar was the particular moment of opportunity around the transition to parenthood. So I'm going to just go through these last couple slides very quickly so we can take questions. So we talked about this moment of opportunity, and again want to highlight that there's this opportunity when parents are reflective and in a period of adjustment surrounding the birth of a baby, and that's one that we can capitalize on and do in many programs like home visiting that are targeted to that period of time, and that's an opportunity to support early and sustained father involvement. And that there are a number of domains for intervention with fathers that programs are identifying and using to engage fathers, and we've listed some examples here. And I'm not going to read that list to you. I'd like to stop here and turn it over to Dave, who's going to guide us through some questions and answers and make sure that we have a little bit of time to get to some of your questions.
Okay, thank you so much, Tova, Daryl, and Craig. And just a quick question, do the three of you have time to run just slightly over on the hour, or do you have other places to be? So
I can stay.
Yep, happy to stay for a few more minutes. Yep.
Okay. Well, so we'll run for another few minutes beyond the hour just to make sure that we have a little bit of time to do that. So, but as a first question, I'm going to combine a couple questions here. But we have a lot of questions about I mean, Tova, you talked early on about sort of different ideas about fathering when it comes to cultural and demographic factors. And I'm wondering if the three of you can talk about specific strategies for sometimes addressing those things and being sensitive to that when you're dealing with like just a kind of a wide variety of fathers. So, Tova, do you want to start us off?
Sure. So I think so I think the central thing here is not to make assumptions for any individual father or family that you're working with about what their expectation or understanding of the role of father is. And so to start with, inviting families to share with you what their perspective is and to support fathers, particularly when we're engaging fathers in the transition to parenthood, to understand what their kind of goals for themselves are and the kind of role they see for themselves, the kind of relationships that they hope to have with their child, and support them to realize that vision. And another piece of that relates also to supporting whole families. So if it's non-custodial parents or parents who are married, but just making sure that the parents who have a vision that is in alignment, so that if there are different understandings of what the father should be doing, supporting parents and working through that, so that the father role is what's going to work for him and for his family. I'll maybe turn that question as well to see if others want to chime in on that, Craig or Daryl.
Sure. So I wanted to emphasize that it's the parents' values that are prioritizing. We're prioritizing here. Everybody is concerned about the safety of the child. Everybody does not want to increase our infant mortality rate. And so we talk to them about what's appropriate, and we talk to them about screening schedules and when to see the pediatrician and when you absolutely are doing things outside of what is healthy for the child and even healthy for yourselves. But ultimately, there may be some areas where the parent is doing something and we may not necessarily say that's what's going to happen in our household, but we have to just let that go. The culture or the relation dynamic, it's not harming their relationship. As a matter of fact, often we will ask them, are these the types of things that your family has agreed to do? If that is the case, we have to let it alone. Sometimes there's someone who seems like they're doing more than their share of the work, but if that is the family dynamic, that's the family dynamic. So we don't intervene in that part. The other part that is extremely important for us, we like to check in with the parents. We want to find out if there's any type of stress that's coming from the manner in which we're interacting with them, because home visiting, you are going into their personal spaces. You want to find out if there's too much frequency with the visitations. So you ask those questions because everybody may not be comfortable with it, but ultimately it is individual. It is true there are certain races and cultures that have similarities, but in the end we want to make sure that we're addressing the individual home environment.
Greg, did you have anything you wanted to add to that?
Yeah, I would just echo what Daryl was saying. I think there are differences by race, ethnicity. There are differences by immigrant and language and culture. And there are lots of different differences, and research really, I think, focuses on the differences. And I like clinically to focus on the similarities. I like to focus on the universal feeling that even amongst couples where there are disagreements at times, overall, the baby can be something that brings people together. And starting from that position, I think really gets us ahead. T. Barry Brazelton had a great saying. He was a very famous developmental pediatrician. He said, parents come to see their pediatrician to answer two questions. One, how is my baby doing? And the other is, how am I doing as a parent? And we need to kind of address both of those issues in order to send the family back out feeling confident about what it is that they're doing.
Okay. So, Craig, kind of based on that idea of disagreements between parents, we do have a couple questions about ways that providers can navigate disagreements when there's sort of maybe like hostile co-parenting relationships, or some of just those challenges between them, the things that people that are in a provider setting can do to help or just to navigate those. And do you want to start us off with that, please?
Sure. I think the, staying from the very beginning, that my role here as a clinician and as a provider is to provide the best care I can for this infant, for this baby, for this child. So my suggestions are for what's best for this child. It may not be what you, mom, agree with. It may not be what you, dad, agree with, or the way that you were raised. But I actually think that this is what's best for the child. Can we all agree on that? Can we have that discussion? And I think that most parents will view that as a good place to start from, and letting them hearing from them about what it is that they don't like. I think making sure that you do give time to air the differences that they have, and then coming back again. In my professional opinion, this is what I think is the best course to take with the child. Usually gets everyone on board in my experience.
Tova or Daryl, do you have anything you wanted to add there?
Well, for me...
Oh, go ahead, Daryl.
Sure. Well, for me, I want to emphasize that the parents are the role models for the children as a unit, and especially when it comes to our work with the fathers. Yes, they're a leader, but leaders also show how they resolve problems. So if there are words or activities either said or unsaid, then we want to make sure that we're able to foster a climate where we can have the person either calm down or reflect, consider what the impact of the child is, and then we may give information from a word bank or, assist with how to facilitate repairing that situation. But ultimately, we let them know that they are responsible for their words and their actions, and it does follow not only in their life, but it does influence what happens with the children. So it's a very, very important role to have as a parent.
Yeah, I'll just add very briefly that this is one in a series of webinars that we've done focused on fathers, and the most recent one before this centered in particular on dynamics around supporting families when there's tension between the mother and the father. So I'd encourage folks who are interested in thinking more about that topic to check it out through IRP or through the prevention board. You can listen to the recording or download the slides to check out some of the information that was shared there.
And I'll link to that when I send out the email later this week with the recording of this webinar. So, okay. And so we have, I think we'll kind of do one more question here, but then I want to give each of you an opportunity to kind of leave us with a sort of parting thought or just a sort of a wrap up here. But we've got a few questions about just sort of resources that can be offered to dads. So, whether it's like sort of a take-home pamphlet or like a website, or just, organizations that you've been able to point dads to and that are actually useful. Do you have thoughts on that? And Tova, I think I'll have you start off on this if you would.
Sure. So, so I think some of this is community specific, so figuring out what's available locally in terms of in-person kinds of services. But then also, on a national level for people who are listening in who are practitioners or who are researchers, there are groups including the Fatherhood Research and Practice Network, the National Fatherhood Initiative is another one that comes to mind, that both have a set of resources available online, and those would be places to look. But I think within a particular community, knowing what's available in terms of parenting programs and father-specific groups, is important for being able to make local referrals to services.
Thank you so much.
I always mention the Men's Health Network because aside from men's health, fatherhood is an element that is paramount in allowing the men to discover who they are. So I give them that information too.
And the last one that I'll throw in is City Dads Group. They are groups of dads of various ages of kids in pretty much most cities across the country that will meet up together in all different neighborhoods just to hang out together with their kids. So I always recommend that to the dads groups that I work with.
So I'm really grateful for the three of you for this presentation. I want to just kind of give each of you an opportunity to sort of leave us with some sort of parting thought. Daryl, why don't you start us off? And I especially love to hear about thoughts you have going forward that are specific to the city of Milwaukee and some of the work that you're doing there.
Yeah, so I think that what the city of Milwaukee is doing is trying to create a unique identity and let people know that we believe in fathers and we know that fathers are essential in building strong families, building strong communities, and ultimately turning around some of these conditions that we see that we're reading about in the news. Most of what the research that I've seen will talk about stereotypes related to low-income fathers or the non-custodial father, and throughout my entire experience, I see that the fathers care about their children. They may not know how to show love in certain conventional ways, but that's what programs like the DAD Project and the Milwaukee Fatherhood Initiative and locally the Pathways to Responsible Fatherhood programs here in Milwaukee, that's what they're all about. Often the men are not going to seek help as quickly as women, maybe because they see it as a sign of weakness, but if you talk to the men about this being an opportunity, this being a way to provide concrete, practical guidance versus calling it help or calling it assistance, the men come around, and that's what we're looking for, maybe changing the language when we do our approach.
Okay. Craig, do you want to go next?
Yeah, I think, my parting thought really is to encourage dads to get in early and get in often. Again, calling from Chicago, that's how we vote here. So I would just encourage that dads, the earlier that they can get involved, the more confident they'll be in taking care of that baby. And then that baby becomes a toddler, and that toddler becomes a young child, and then an adolescent. But it goes back to the very beginning where they can feel confident and learn the confidence in taking care of their baby. And then that can grow in terms of their involvement overall with that child. And the research has shown that the more, for example, leave time that dads take, the more involved they are early on with the baby, that pays off in dividends down the road as they feel more comfortable and more confident in taking care of that child as that child grows.
Tova.
Thanks. I'm going to do a very quick acknowledgement and then a parting thought. And so the acknowledgement, I just want to point out on this last slide that you're looking at, we're giving photo credit here to the Alameda County Father Court's Fatherhood Photo Bank, and I wanted to name that as a resource for all of you who are listening, that they have a really wonderful selection of beautiful photos of fathers and their families that they make available for download for educational purposes, for research presentations, to have fathers represented in your program materials. So it's something to check out. And then, my parting thought would be, I want to echo a little. So Daryl, was saying earlier how he emphasizes with fathers that it's not about, about being perfect, but about, being consistent and making efforts and kind of growing into the father that you want to be. And I would just say for programs that I think there's something a little bit similar that we can make a parallel. So I have a background as a home visitor and worked with programs where historically the programs were really, we were trained as home visitors on the assumption we'd be working with a mom and a baby, and the change was pretty incremental. And so starting from a different place than the kind of program that Daryl runs, which really begins with fathers, but any efforts that you can make within your programs to, to take strides towards engaging fathers, to when you have a father who participates in the program, to enlist him to be an ambassador for the program, thinking about kind of small steps and the kinds of interventions that Craig was talking about in terms of making people feel welcome right away and directly engaging fathers right away, that for programs that are maybe earlier in the journey of engaging fathers in the services that you offer, that there are small ways to start and to grow and to really increase your inclusion of fathers in a way that will be impactful for children's health and development.